I'm Dr. Spencer Russell.
And I'm Dr. Alex McCree, and we're here at Jack's Implants and Dentures to talk to you today about the differences in full mouth implants and what options you have available. There's quite a few options out there, and we spend an immense amount of time explaining to patients what is possible, what is even in the realm of possibility for each specific patient, and also, more importantly, as a lot of people come to find out, a lot of people don't talk about the cost, and we're going to be very transparent today about what all options there are, and then what would be on the back end of how much that costs on each option. With that started, to keep it kind of quick today, well, Dr. Russell take it away, and he'll start with our option number one.
So these are our traditional denture options. So with these, you're getting pre-made teeth, these carded teeth, set in an acrylic base. So with these, you're looking at best anywhere from 10 to maybe 30% of your maximum chewing force. So with that, you're not going to be able to eat a lot of the things that you want to. On top of that, the whole roof of your mouth is covered, and that's where a lot of your taste buds are. So one of the main complaints we hear from people, other than their dentures don't stay in place and they're falling out, is that they can't taste their foods like they used to, and everything just tastes really bland to them. So really the only time I recommend this to people is when we're just stuck with costs and there's really no other option we can go with, then dentures are your option there, but it's never gonna be your best option.
Now, how do those stay in?
So with an upper denture, you can get a little bit of suction. That's why we cover the roof of your mouth. With a lower denture, you're really never gonna get any of that suction. And they just never fit that well. You always have to use some adhesive to stay in place. And you still have that concern of when you're eating certain things, or if you were to laugh, they have the risk of falling out. I don't know if you've seen that video of the grandma skydiving. She opens her mouth and you see the set of dentures just go flying into the wind. So, I mean, with our other options, you wouldn't have to worry about that, but it is a possibility with traditional dentures. So we really don't like to recommend these unless we just absolutely have to due to finances. All right, so from there, now our next option up is our snap-in denture or our overdentures. So with these, very similar concept, traditional denture, but now we're adding implants into your jawbone to allow us to secure this in place. So anywhere from 2 to 4 implants on the bottom and 4 implants on top. And with these, after 4 months, when those implants have healed, we put little snaps in. So you can kind of see these little nylon inserts, and then we have little caps on top of the implants. And then so you place this in your mouth and you can hear this snap and know that this is nice and secure in place. You still get a little bit of rock here. So because of that, we're talking anywhere from 50 to 65% of your maximum chewing force. So as you can see, way big increase from your traditional dentures, but still talking being able to eat maybe half the foods that you want to.
What are some drawbacks of that? So obviously they're better than dentures, and they snap in.
But you still have acrylic. So you do have that risk of fracture. Because acrylic is just a lot weaker, you have to worry about the whole denture snapping or teeth popping off. You do also have the maintenance costs of these snaps wearing out over time. On average, we get maybe about a year out of them before they get a little too loose and they're maybe not staying in like you would want them to.
What are the cleaning methods of a denture? Or do you have to soak them every night? Do you have to take them out?
So as long as you're keeping them clean, I do recommend wearing them all the time. You do have to take them out at least once or twice a day, use a denture brush, some warm soapy water, clean everything really well, and then you still want to come around and clean around the implants themselves. Otherwise, this gum tissue can get inflamed and then it can cause your implants to fail. So you still want to make sure you keep things really nice and clean, but for a lot of people that means after they eat, pop them out, brush it real quick, pop them back in.
And I would say the biggest advantage that I'm not sure they touched on yet was on the upper denture, that covers the roof of your mouth. That is, you can't taste foods quite as well anymore, right? So people don't think about it having actually some taste buds on the roof of the mouth, but it makes quite a big difference so you can't taste. So on the upper denture here, when you have 4 implants placed across the top, you actually can take out the roof of the mouth, and so it's not relying fully on the suction anymore. Now it still has the flanges right here, so it's gonna kind of stick over the ridge of the gums and stick kind of a little bit on the cheek side here, but it actually can stay in so you can taste food a little bit better.
And as Dr. Cree kind of alluded to there, you do still have these full flanges on the snap-in dentures and the regular denture options. For a lot of people, that may mean that your lips are a little bit more bulky and your lips kind of have to work their way and get used to wrapping around those, versus our all-on-4 options, we don't have that flange.
Okay, so that brings us to our all-on-4 options, which goes by a lot of different trade names: all-on-4, all-on-X, all-on-6, full mouth implant bridges, teeth in a day, teeth in an hour. There's so many that people come up with all over the place. But it all basically is referring to the same thing: fixed implant bridge of teeth on implants that are delivered either the same day or the next day. So you go from teeth, or if you're in dentures, obviously not teeth, but immediately after implant placement, the teeth are actually screwed on, and so you walk out basically that day with teeth screwed in. Now, typically we start with a temporary set. There are some centers out there that will say immediate final, and we'll get into that, why that may not be a great idea. We had the ability to do that, but we try to have the patient's best interest at heart when we're doing these type of procedures. So you would walk out that day, basically you would not see above that, and you don't see any flanges here. So these teeth right here is an actual set designed off a patient that we've done here. This is what you would walk out with. And like he alluded to earlier, everything can be custom designed, so you'll see different color gums, different shaped teeth, different shades. Everything can be completely customized to fit your face. We actually use photos here. We actually bring everything in. Everything is digitally made, so that way it fits, designed to fit perfectly to what fits you. So we, can exceed or at least match what your expectations are going to be aesthetically.
So after your 3 months of healing process, now we're going into our finals. So for our finals, we have a couple of different options here. With them, our main option that we recommend to a lot of people is what we call our midline. For a lot of centers, this is what will be their kind of top of the line option. It is monolithic zirconia. It's a very, very strong ceramic material. And when you're in the office, we'll show it to you. You can feel the weight difference between your 3D printed temporary or an acrylic option.
Now,
it's zirconia.
When you're saying it's heavy, can you feel that in the mouth?
No,
Are you going to
so
feel that?
everyone gets concerned because you feel the weight, you feel the heft of this, how strong it is. People get concerned. They say, oh, is this going to make my jaw feel heavy or anything like that? You never feel this in the mouth. It's fully supported by the implant, so you don't feel that weight. But what this does is it gives you that strength. You don't have to worry about this breaking. And like I said, for a lot of places, this is their top of the line option. For us, we call this the midline, and then we still do offer something one step above this that we call our dream line.
And so that's what he's referring to here. And then as you can see on all these all-on-4s, the flanges that we spoke about on the dentures, those are not there. So these fully, like you said, sit just on the implant. So this is the thinnest profile option that is available on the market. So he was referring to the Dreamline. Again, that's just a term. So basically what that means is there's a titanium bar actually with individual milled zirconia teeth that go over the top. And what that allows us to do is to have the structural support of titanium, which is incredibly strong. This is milled out of one piece of a billet titanium, and each individual crown is actually able to have its own individual support. The odds of this breaking are almost not possible, and even if you did chip a tooth, you would actually only have to replace just that one single tooth, which is extremely easy. You wouldn't even have to be numbed up for it, again, because it would be on the titanium bar.
So this option is going to be for your very heavy grinders or your big guys. Say you're a 6'5" ex-football player, really strong jaw muscles, we may recommend this option to you. But like we said, this is really just very, very strong extra strength. If we're worried that you may potentially be able to break this zirconia option, then we may recommend that. Not required for a lot of people. Aesthetically, looks very similar, maybe looks a tiny bit better, but for most people, you're not going to notice that difference. It's really more of a strength thing. Now, touching on that, you mentioned about the possibility of a crown chipping or something breaking. Now, how does that work for a patient within a warranty period, or?
Yes, so we offer full warranties on everything we do. We actually advertise those on our website, as that we advertise our prices because we try to keep it very transparent on everything that we do. One thing I didn't quite touch on yet earlier, I mentioned that there are some centers that say, hey, we go straight to final, or we go final in a week, or anything with regards to that. We say, hey, well, you're going to be in the temporary for 3 months. Well, what gives? Why are you waiting 3 months and they go immediate final? We do all our lab work in-house from start to finish. So we have the ability to make you a final zirconia or a final Dreamline in a week or the next day. That's not really the issue. The issue is, much like the healing with the dentures and the overdentures, the bone underneath is still changing. So what happens is, if you skip the 3D printed or the temporary that someone may give you at one of these clinics and go straight to the final, what happens is this is made straight to the gums and it's gonna fit very, very flush. And if you go ahead and straight to final, you can't reline that appropriately. So what happens is little gaps form everywhere. And they don't tell you this at the beginning, but what's gonna end up happening is actually food's gonna get stuck in there and gonna be very, very hard to clean. And there's not really much you can do about it at that point. So what we do is we allow the gums to settle. So we start with the temporary, and then if those little micro gaps form, then at about the 3-month mark, that's what we're really waiting on. It's just everything to settle. So then we kind of make your final to fit very, very close to that. So it's much easier to clean and maintain for the long term, which is why we do warranties and everything, because if we're gonna do it, we expect it to last.
Yep. And so for our different options, we do offer different levels of warranties, and that just kind of goes for the difference in strength. So we offer that streamline option. Really, we just consider that a long-term temporary. So this is your 3D printed option here. We offer this and recommend it for no more than 6 to 12 months. This is just to kind of get you into that fixed option. But knowing that you're going to transition to a final that's a lot stronger down the road. Then from there, we have our zirconia option. And with this, we offer a 5-year warranty, no questions asked. Some places are going to give you tons of exclusions. They may say if you're a smoker or if you're a grinder, they're not going to cover your warranty. With our warranty, it's just no questions asked. If it breaks in 5 years, then we're going to replace it for you because, like we said, this stuff is incredibly strong and it shouldn't be breaking. And then our top of the line option, the Dreamline, we offer a 7-year warranty on that as well. And really out of either of these, we're expecting much, much longer than that as well. The latest studies I believe we've got are 10 to 12 years and with a 98% success rate on these without any kind of fractures in them. So both of these options, the Midline and the Dreamline, are very, very strong, but we do offer that 5 and 7-year warranty for some peace of mind for patients.
And we actually can do that because, again, like I spoke about before, we have that everything is in-house. So if something were to happen, whether it be surgically with the implants or prosthetically with the teeth, everything can be done here. And it is a one-stop shop, a full implant center with full suite A to Z, with the fabrication of even everything to do with the final. So with that, if something were to happen, we're always available to be able to correct that and get whatever that patient needs.
And like Dr. McCree said earlier, I personally oversee every single design from the temporary to the finals, so that way we can head off a lot of these issues before they occur, but then if things were to happen, we can make sure they're correct and you're repaying. So for our traditional set of dentures, you're looking at a range of anywhere from maybe $1,000 to $2,000 for an upper or lower, plus your cost of extractions.
Okay, so if you were to need quite a few extractions and then upper and lower, what would be I know you can't hold it to an exact figure, but what would be a nice clean, estimate of what that would cost me to get into a nice set of dentures with some extractions?
Upper and lower extractions, you're looking around $4,000 to $5,000.
Okay. And so that seems still what do you get for that though?
So, I mean, you're getting your upper and lower set of dentures, your extractions, but like we said before, you're gonna have ongoing costs over time. You're gonna need relines as the bone and tissue heals, it shrinks over time. Whenever you don't have any teeth, you don't have any implants, there's no reason for your bone to stick around. So that's why you end up needing these relines every couple of years or so. And then you could break a denture 3-4 years. Like we said before, it's acrylic, it's not indestructible. They can crack over time. You can pop teeth out. So there are ongoing costs with these that you should be aware of. So that $4,000 to $5,000 figure can add up over time. So that being said, we'll then go into our snap-in denture option here. And it's very similar in our pricing model where it is the cost of the snap-in denture plus the cost of extractions. So for an upper or lower, you're looking at anywhere from $4,000 to $7,000 depending on the number of implants you're interested in getting. We do sometimes do a 2-implant lower snap-in denture if the budget is what that dictates or what we need to do, but we really prefer to do the 4. It just gives you a lot more stability because with the 2 implant denture, you've only got them in the front. So you're gonna get a lot more rock, but at least you don't have to worry about them falling out of your head.
All right, so that brings us to the price of the all-on-4. The full mouth implant bridge is what most people have probably watching this video want to know, because that's the top of the line option, and that's what they want to have so they can chew and live their life how they want to. The average price, or a range, would be somewhere between $15,000 to somewhere in the low $20,000 per arch. And what an arch is either top or the bottom. That doesn't mean that that's going to be every single case, but we keep that pretty close to what we have on the line. We group everything together, so we don't really charge by the extraction. We typically don't charge for any extra grafting. So that way,
nickel and dime you on that kind of stuff.
So that tries to keep it, so that way when you see what you see is what you get online. So, I say I can't tell what your specific diagnosis is, but at least that's an honest, transparent price, so you know what you're getting into before you want to, make a consultation or go down this road.
Now, that is a lot of money. So how do a lot of people go about paying for this?
So some people, they're blessed financially, they're able to pay for that in full. But I would say the majority, up to 80%, do some sort of financing, whether they do, we have a lot of third-party lenders here. So what that is, they may pay for a little bit down, they may finance some of it. We try to break it up sometimes where we pay for maybe the surgery only, and maybe extend the life of the temporary a little bit longer, so we can get that to what they want. And the reason we do that is because a lot of people want this option. Obviously, they don't want to go through the horrible healing period of the dentures. They want to be able to live their life how they want. They want to get back to how they were when they were younger. They want to feel confident in their smile. And I understand that, because I also want that for myself. And with that, we try to do anything that we can get to do to be able to get them into what they're wanting. Because this right here does, it's pretty apparent, gives you a better lease on life. You're able to live your life how you want. And if there's something that we can do at our clinic to help you get there, then that's what we're gonna do.
And as you mentioned earlier, we know it's a lot of money, and it's similar in price to a car. So a lot of people, you go to a car dealership, you're not just coming in with cash, buying that car outright. Some people do. Like you said, some people can come in and pay for this all out in cash. But for most people, that doesn't make sense. So like you said, we offer a lot of different lending options. For a lot of people, that means you're making $250 payments a month on this, and you can get yourself an upper set of teeth. And so we really like to break that down for people, so you're not having to drop down a big lump sum of cash, and you're still able to get the smile that you want, and you're able to eat the things that you want.
All right, so that's kind of all the information we have here today. We've kind of went over the main 3 options, which are dentures, snap-in over dentures, you may see that term, and then again, the all-on-4, all-on-6, full mouth implant bridges that we have here, right here. If you have any more questions, please feel free to reach out to us. Our website is jacksimplant.com, and our phone number is 904-999-9000. We offer complimentary consultations. We'd be more than happy to see anybody and see what your options are and see what would be a best fit for you individually. Again, I'm Dr. Alex McCree.
And I'm Dr. Spencer Russell.
And we're here with Jackson Implants and Dentures. Have a great day.